name's Gemma Upson. I'm the General Manager of Inklings at the Kids Research Institute Australia.
This is a very big day. It's the launch of the Inklings program. What the pilot program hopes to do is literally change lives. It's about as close to a miracle as you can get, because what we see is that if you can help them early enough in their families, you just give them a different trajectory in life. And what Inklings is doing is supporting families, and it's helping families understand their children.
This will really make a huge difference to 700 families in Western Australia. We know that the earlier we intervene, the better the outcomes, not just for the children, but for the whole family unit. And that's what this program aims to do.
The impact the Inklings program has had in WA in the last year has been through the pilot, through the NDIS, and that we have already seen 160 children start the program. And the impact this has had is given an option to families where usually they'd have to wait and see, where we're giving them an option of support right when they need it. Some of the outcomes of the pilot to date have really been that families have felt they've been able to understand their baby and really been able to bond with them earlier. So often when babies have quite subtle communication cues, the parents don't quite understand them, but what we're giving parents is that ability to understand and bond with that baby really early on in life.
My name's Lindy Henry, and I work in Inklings as a practitioner and also as a trainer, and I've been involved in developing the program. Inklings is a program which supports children and their families where the child has some differences in the way that they communicate and interact. It's a program that uses video feedback, and in the session the child and parent interact in a particular context. And the practitioner will video that interaction about 5 or 6 minutes. Then the practitioner and the parent sit together and look back over the video, noticing the different ways that the baby's communicating and also noticing how the parent is responding, and particularly how the parent's responses support further interaction.
I'm Professor Andrew Whitehouse, and I'm the Professor of Child Development at the Kids Research Institute Australia. The journey around Inklings started with our clinical observations, is that we know that children develop differently very early on, but actually our clinical systems only provide support for kids at about age 3, 4 and 5. So we understood that we needed to develop new programs to take advantage of brain development very early in life. So we worked with our colleagues in the UK to develop that program. We conducted a clinical trial within the UK which found that providing this particular program reduces disability when we see those kids later on. And then we needed to provide a second clinical trial to make sure we had that replicated evidence, and that was the Australian clinical trial. So more than 100 infants who were developing a bit differently received this program in Perth and Melbourne. Then we followed the kids up until they were age 3. Sure enough, we've replicated the findings that receiving the Inklings program very early in life reduces disability when we see them again at age 3. A really exciting finding.
Over time, so the program is 10 sessions, parents begin to see things for themselves. So the program doesn't really overtly teach new skills, but through this medium of video feedback, the parent really sees their baby and themselves from a different perspective. The videoing actually enables the parent to take a breath, if you like, and take a bit more time to look back over this moment in time of play or of sharing a book or of sharing nursery rhymes, or we have a mealtime session. And see in more detail some of the perhaps subtle ways that their baby's communicating that they might just not notice in the hurly-burly of daily life with their baby.
Babies are born with remarkable abilities to communicate, but sometimes these social interaction and communication skills can develop differently to what we typically expect. The baby may not meet milestones at expected time points, or they may communicate, play, or interact differently to other babies of the same age. If a baby has delays or differences in the development of their social interaction and communication skills, it is important to have a closer look to see if the baby needs support. Inklings is a program for babies aged 6 to 18 months who are showing early differences in their social interaction and communication development. Backed by decades of rigorous scientific research, the program uses short videos of a parent interacting with their baby to help them to better understand the different ways that their baby communicates. With the guidance of a trained practitioner, parents allow their baby to direct their own play and lead interactions with others while building on their own strengths as a responsive communication partner for their baby.
Inklings is appropriate for babies who are showing early social communication delays and differences between the ages of about 6 to 18 months. So we can observe a number of different behaviours that indicate that babies may be eligible for this program. Things at 12 months, for example, such as not responding to their name consistently, perhaps not pointing to show interest, and even not imitating, such as waving bye-bye or clapping hands. Now, any one of these different indicators in and of themselves is not too much to worry about, but when we see a whole lot of these coalescing in the same baby, it's at that time that we start to say that maybe a program like Inklings might be important and appropriate for your baby.
The children are coming into the program having been referred by somebody who's observed some differences. So that might be the parent, it might be the family's child health nurse or GP, family member or friend, other health professional.
The Inklings program has provided access to families where previously there was nothing available. So typically a family would come into a practitioner and they wouldn't be sure what to do, and they'd say, let's just wait for a while, come back in a couple of months or years and we'll see how you're progressing. What Inklings is giving them options straight at the time that they're concerned, so they can really benefit the family and the practitioner.
Inklings practitioners are drawn from a range of different professional groups. We've had speech pathologists, occupational therapists, psychologists and nurses, and others have come through the training. So these are all people who have got an interest in working with families with a baby who's aged between 6 and 18 months, and also with experience in working with this age group.
Healthcare practitioners have really been excited about the program, one because it gives them an option to deliver a program to a family when in need, and what they've also found is they've been able to work with families through a structured program and really deliver them some strategies early on in life.
Our measure of success is connected parents and babies, and we can measure that through how parents are interacting with their baby, how our babies are interacting back with parents. There are very objective means through which we can do that. But ultimately, that parent-child connection, that's the mechanism, the active ingredient. What we want to see are those gains in the child, gains in terms of language development, in terms of social development, in terms of how they're interacting with the world. Are they ready for school? These are the kind of things that ultimately we're seeking to help, support and help the child on their journey.
I find that it's overall well received, and people really take away some good messages from the program, really around that. It's valuable to be taking time with my baby. Slowing my pace is important. Following my baby's lead helps them to initiate, and as I respond sensitively to them, then communication opportunities are built. And these messages come through, and parents really appreciate them. For my own experience, it's been a very rich journey for me being involved with Inklings. I've worked as a child health nurse for my whole career, and this program really gives you something quite concrete to invite families to support communication and interaction.
Feedback from our WA families, which is almost 60 who have completed the program now, has been really exciting, and it has grown in WA. We now have 5 organisations that are delivering Inklings across the state, and this is we've had a lot of demand from other providers wanting to also deliver Inklings. So this is really exciting. The data's looking really great. The feedback from the families has been overwhelming for us, and we've also had a lot of other other providers across Australia wanting to deliver Inklings. So as we progress through the pilot, we're really excited to get some data in and to really show the benefit of Inklings to a broader community.
Inklings started as an idea that we can provide support to babies much earlier than ever has been provided support before. We then went through those 15 hard years of clinical trial work and found that those findings within an ideal setting, a research setting, that actually babies can have their reduction in disability through the Inklings program. Now we're seeing this translated into the real world. And so I have families coming to me and telling me that this has not only just changed their understanding of who their beautiful baby is, but also increased the connection with their baby. And what's more, actually, they're seeing the dividends in terms of improved language output, in terms of better temperament, more regulation of their emotions because they're able to communicate. To take it from an idea all the way to receiving that feedback in the clinics, it's the ultimate.
After WA pilot started through the NDIS, the Department of Social Services created some funding for another state in Australia to take on Inklings. So South Australia were successful in the bid for that state, and then we started liaising with South Australia in how the Inklings could be put into their community and implemented into South Australia. So we've been supporting them along the way to help set up and create and find the learnings from the WA model. And then what we'll also be doing is training all the practitioners in South Australia to deliver Inklings, as well as we've created a digital platform again to support the practitioners, but also the data collection and the reporting for the South Australian government to then work with the Department of Social Services.
GPs or health professionals can refer to the Inklings program by referring straight to the website. And what we can do then is doing an eligibility screening to see if Inklings is actually appropriate for that baby.